Welcome to this video. My name is Dr. Farzana Hoque. I'm an attending physician of internal medicine, currently practicing in a big academic medical center in the US. I have been the interviewer for internal medicine residency training candidates in the US for last couple of years. If you are new to this video, welcome and thank you so much for joining me today. Many viewers of this channel asked me that how to address any red flags or how to tell that if an candidate has any failure or any attempts in any USMLE steps or maybe in medical school. In this video, I will share with you 3 step-by-step approach that you can utilize to formulate this answer if you have any red flag or any failure in your CV that will prepare you to address these red flag or failure questions during your residency interview with confidence and professionally. First tip is that you are the person who should bring any failure or any red flag spontaneously during your interview. Please do not wait for the interviewer to ask that failure question specifically. I can tell you that the interviewer or the program director will know about that red flag or failure because they review the CV before the interview. They will go through your portfolio before the ranking. If you are bringing this red flag or failure by yourself, you will have 2 advantages. First, it will give the message that you are honest and have the confidence to tell about your weakness or any failure. And secondly, if you are bringing up this issue, then you will have that opportunity to address and let them know that truly what happened and what was the main reason for that failure. Secondly, you should be tell that, okay, what are the steps you took after you had that failure? For example, 2 years ago, one of the candidates told me that she had to take the USMLE step because she was pregnant during the first time. So she told me that what things she did to pass the USMLE step 2 second time. She called her mom to take care of her child. She went to a learning specialist to find out which way to learn first, what are her limitations. And thirdly, she practiced all the question banks in a timely manner in exam mode so that she is very efficient during the exam and has the capacity to read the questions very quickly and identify the keywords efficiently to find out the right answer. Did you see? She told me 3 things that she did, how to pass the USMLE step 2 second time. And the third tip or the last step of your answer should be, what lessons did you learn from that failure? You must include this part in your answer because failure, mistakes can happen. We are human beings. Everybody knows that one mistake should not prevent you to move forward. The most important point of this answer will be, what did you learn from that failure? So when you are answering this question, the last part, you should say the lessons. For example, that candidate told me that she learned that she need to ask for help. Secondly, she told me that by going through learning specialist, by practicing the questions in a timely mode, she find out that although she knew the content, she did not know how to answer those questions in a timely manner during the exam. So she learned how to manage the time during exam, and she is now applying the time management skills during her medical training as well, during her medical school as well. So to summarize, the 3 steps will be: first, you should be the person who bring up any red flag or failure during your interview. Do not wait for the interviewer to ask for it specifically. Secondly, tell them that what are the steps did you take to overcome that failure. Finally, what lessons did you learn from that failure, and how you are a better person by having those lessons from that failure or red flag. The one bonus tip will be, if you are trying to answer this red flag or failure, you can bring this issue during the strength part. For example, if the examiner is asking you, okay, tell me what are your strengths, then you can tell that, okay, I had this failure, and then what did you learn from it? Like, you became more adaptable, you were open to learn, and then you are more resilient person than before because you have learned from this mistake. So I hope you will find these 3 steps useful to answer any red flag or failure questions during your residency interview. And remember, you can use this 3-step formula during your interview, regardless of any specialty or regardless of any failure. I hope you found this video useful. Please like this video, share this video with your friends, with your colleagues, whom you believe that will be benefited from this useful message. If you have any questions, if you want me to make a video on any particular topics, please put it in the comments below. I always make sure to read them very attentively. Please subscribe to this channel, and because when you are subscribing, it keeps me motivated to make more useful videos for you. I wish you all the best in your both personal and professional lives. I will see you in the next video. Take care.